What is anxiety? Normally, our body is supposed to respond with fight or flight in stressful situations. That means we either fight the problem we're facing or run away from the problem. This is a normal defense mechanism of the body against stress. Anxiety occurs when there is an imbalance of chemicals in our brain, specifically, increase in norepinephrine, decrease in GABA and serotonin. Norepinephrine is a hormone involved in the sympathetic pathway, while GABA is an inhibitory hormone. Decrease in GABA lead to increase in excitatory activity. Serotonin is the hormone we associate with happiness. So what can cause anxiety? Environmental factors such as stress from personal situations, childhood trauma, financial problems, etc. Anxiety can be situation dependent. Until we get control over the situation we're dealing with, anxiety may persist. Smoking and substance use are associated with causing anxiety. Medical conditions such as thyroid problems, heart conditions, asthma, etc. are also associated with anxiety.
How can you say that you're anxious? Common presentations are feeling irritable, restless, and sometimes nervous. Muscle tension and difficulty concentrating can also be seen. Some of other physical symptoms could be fatigue and insomnia. In young adults, hard teenagers, anxiety can present as more irritability.
When is anxiety concerning? Evolutionarily, anxiety is a normal response by the body to protect ourselves from stressful situations. Modern-day living brings more anxiety and stress to our days. For example, social media, financial problems, academic stress, etc. Normally, our body has its own equilibrium. When there is hormone imbalance due to anxiety, our body makes other hormones to compensate and readjust our hormones. Anxiety can be concerning if it affects your day-to-day life.
So what can you do immediately when you're anxious? Since anxiety is a normal response to stress, being aware of the symptoms you're experiencing will be the first step. Once you are aware of the symptoms you feel, you can then act accordingly to make changes. The goal is to change how you feel by creating a different state of mind. For example, drinking water can stimulate the parasympathetic, which is responsible for rest and digest part of the body. Hot tea can warm your body and give you a sense of comfort. When should you be taking medications? First steps in dealing with anxiety is to be aware of the symptoms you're experiencing and recognize any triggers or situations that are causing anxiety symptoms. Practicing healthy coping skills such as breathing techniques, stepping away from the situation, and learning to cope with the situations that are causing anxiety, talking to someone who understands, etc. Depending on the severity of symptoms, proper sleep hygiene and food such as eggs, cheese, salmon, nuts, etc. can help. They increases serotonin levels in our body and can help control anxiety symptoms long-term. Consider medications when you feel like the anxiety symptoms are affecting your day-to-day life. Medication treatment for generalized anxiety disorder, GAD. Anxiety is considered as generalized anxiety disorder, GAD, if you have persistent symptoms for more than 6 months. First-line treatment for anxiety is cognitive behavioral therapy. This is when you work with a professional to help you identify the triggers and help with behavioral modifications. First-line pharmacotherapy is SSRI or SNRI. These medications increases serotonin in your body. Second-line medications are buspirone, TCAs. Benzodiazepines may be given for short-term use.
What other differentials are similar to generalized anxiety disorder? Adjustment disorder. Anxiety or depressive symptoms lasting less than 6 months following a stressor such as divorce, moving to a new city, new job, etc. Panic disorder. recurrent panic attacks due to overstimulation of the sympathetic system. It is considered as a disorder if symptoms persist more than 1 month. First-line treatment is CBT, cognitive behavioral therapy, and antidepressants such as SSRI/SNRI. Social anxiety disorder, SAD. Anxiety lasting more than 6 months in association with social situations such as meeting new people, being in public, etc. First-line medication for social anxiety disorder is SSRI/SNRI. Performance-only type of social anxiety disorder. Type of social anxiety disorder that is associated with giving a speech, performing in front of people, etc. First-line treatment for performance-only type of social anxiety disorder is propranolol or benzodiazepine.
Other associations to consider. Substance or medication-induced anxiety disorder is when you experience anxious or panic attack symptoms after using or stopping a substance or medication. Alcohol, marijuana, amphetamines, caffeine, corticosteroids, etc. are examples. Usually occurs within 1 month of using or stopping a substance. Anxiety due to medical conditions. Anxiety can also be due to medical conditions such as hyperthyroidism, hypoglycemia, asthma, arrhythmia, insomnia. Always remember to talk to your medical provider if you are experiencing any symptoms that are concerning.